Yeah. What's up, guys? I hope you guys are doing well. It's been long since I last did a show. I think it's more than a month. Um, and today I wore a very nice Italian Brioni suit, and I felt like I need to. I've not worn a suit in a very long time, and I felt I need to do a video. Um, and somebody was asking me, where did my Infinity go? You don't speak about my Infinity anymore. Um, and you don't do those videos, the podcast. So this is not a podcast, it's more of a show. And truth be told, the main reason why I didn't do any of the a video in a long time, especially last month, is because I was going through shit, man. I was not mentally okay. It's the same month that I almost lost my ear. You know, somebody robbed me. Robbed us. I lost my phone that I used to record, and then I lost. This is the same month I lost money in crypto. Somebody uh, scammed me. I lost quite a lot of money. So it was just a shitty month, and I was also not physically well. There are some points last month where I felt quite sick, and so I decided, sometimes when you're doing these videos, you have to do them in the right state of mind. And I honestly was not in the right state of mind. I was physically, mentally, even financially drained. So I will not give up. Now, the reason I'm doing this video is to talk about one of the most common issues that I'm seeing in the society, which is mental health. Was it first? I think it was last week. Was it 10th, 11th? It was last week. We were doing World Mental Health Day. I think it's October 10th, if I'm not wrong, or 11th. And one of the things that I said is we are having a lot of commercial activists in mental health. So these days you hear everyone is a mental health expert, mental health advocate, mental health counselor. But do they really understand what mental health is? I'm a psychiatry resident. I've worked in psychiatry for long before I even became a resident. Basically, all the things that I handle are psychiatry related. So I've just pivoted into what I do, and I feel like it's a very interesting case. So people don't. Today, I want to talk about the diagnosis of a psychiatric or a mental health issue from a doctor's perspective to a patient or client perspective. Medicine is changing. Normally we'd say doctor-patient relationship, but these days these are things that you learn in the Western culture, that we say patient-doctor relationship. That means that the art of medicine has always been about identifying problems and faults in people. But that is changing, so we are embracing more of a patient-centered approach. That's why we started the word patient. So we want to see, we are treating your issues, but what are we going to do about the positives? Why can't we maximize on your positives to help you get better? And that is the essence of medicine. And for me, I want to be a very, very unique mental health doctor or a psychiatric doctor. That's why I do a lot of research. I read. I don't like how we take things in our healthcare system, perhaps because I have had some experiences in other healthcare systems. But when it comes to mental health, I have realized that everyone diagnoses themselves with mental health. So you see someone like online, you see someone, like for example, I'll give an example of Elsa Majimbo. So Elsa Majimbo is one character that I've seen everyone talking about her being mentally unwell. There are those things that people do in the society, and we say this guy is not okay. Even our friends and families, they do things, and then we say they go through things, and we say we are not okay. There's a video by an Ukrainian actress, and it was a video I saw it today, and she was demonstrating what living with depression is like. That there's this burden that you feel it's pulling you back, you are not emotionally there, you feel worthless, and those kind of things. So these things happen. These things happen, and I just feel like it's important we know what are the steps, what are the medically acknowledged and recognized steps that you have to go through before you are fully diagnosed as having a mental health problem, be it depression, be it anxiety, be it psychotic disorders, which is quite common, shockingly, with be it substance use disorder, be it sexual use disorder, be it eating disorder, be it neurodevelopmental disorder, be it neurocognitive disorder. I mean, there are quite more than 15 different types of mental health disorders, and yet we only talk about 3 or 4 of them. So what is the process? The process of being diagnosed with a mental health disorder is just like any other disease. So you have a headache, your headache takes you to the doctor. So for example, if you're having fevers and headaches, or whether you're vomiting and you're having diarrhea, so depending on how severe the symptoms are, you might find yourself taking yourself to the hospital. Now with mental health issues or problems, it's more of the same thing, but we tend to realize that these things happen longer. Okay, for example, if you're having vomiting and diarrhea for 3-4 days, what happens is that you are at risk of maybe being dehydrated or having electrolyte imbalance, which has consequences. For example, when you're diarrheaing, you have low potassium, which can affect your heart. Or when you're having severe diarrhea, like in cholera, you can go into hypovolemic shock. So this is what takes you to hospital. So you can either go to hospital at the onset of the symptoms, when you don't really have much complications, or you can actually wait when now you are complicated. Okay, and that is the same also with psychiatric disorders or mental health disorders. So you feel a type of way. Now, basically, psychiatric disorders are a change in your behavior, your emotions, and also your cognitive functioning. I mean, those are the 3 main things when you talk about mental health. Basically, we are saying WHO defines health as, a state of well-being, and not merely the absence of a disease, depending on what. So in this case, applying the same context in mental health, you're talking about your cognitive well-being, your emotional well-being, and your behavioral well-being. So any distortion on these 3 things, you start having a mental health problem. So for example, when you talk about cognitive things, so cognitively means you are not able to think well, you have lost your memory, your concentration is affected, you don't pay attention, your judgment is poor. If we say, tell us who was the first president, you cannot tell. Tell us the difference between a bus and a train, a pears and a mango. Those are abstract issues. When we tell you, we give you a scenario and tell you to tell us what you do, I mean, what's your judgment of the situation? So if you're not, these are cognitive assessments that we do. So if there's a problem with any of that, we call it, that's a cognitive effect or a cognitive problem. Now, when you have problems with your emotions, you're being too happy, you're being too sad, you're being too moody, you're being too angry, outside the norm, and this is affecting you. That is we can have an issue, emotional issue there, which can qualify you to be mental health issues. And that happens in cases of, you have heard of the major depressive disorder, you have heard of bipolar, you have heard of mania. When you talk about cognitive, you talk about cognitive, so behaviors. So normally when you start talking to yourself, when you start walking around, when you start seeing things, when the way you talk to people, the way you dress, the way you look, you start becoming, unhygienic, you dress funnily. So your behavior, any alteration in your behavior that tells us that there could be a problem with your mental health issue. So those are the three main things that determine our assessment of a patient with a mental health problem. And it's very important because one of the most critical issues that we face in mental health is stigma. Stigma, because people simply we diagnose people, huyu ni mwenda wazimu, huyu ako depressed, huyu amechapa, huyu akafanya hivi. So it's important that we understand that aspect of mental health and mental health well-being. And how do you understand that? And that's why Mindfitty comes in, like my platform. So I've built Mindfitty around people doing self-assessments for themselves. So when you feel you have any of this, whether your emotions are altered, your behaviors are altered, your cognitive functions are altered, you can be able to check yourself. So one of the problems that we face, especially most of the patients that I've seen, like in Mathare Hospital, they come when they are at the secondary and tertiary stages. What do I mean? They come when they have already done things, when they have already broken things, when they have already tried to suicide several times, when they have beaten people at home, when they have stolen and sold things at home. So they come when the symptoms are quite severe. But there's that onset of things where, today I'm not feeling okay. My mood is low. I am not feeling good. I don't have the appetite. I think I have work stress. I think I have burnout. And all these things, I put them. If you log into Mindfitty and you go to the assessment, that is the first thing you see. You see the different self-assessment tools that we use in psychiatry, and also we see the different work related tests. For example, stress, work stress, burnouts, sleep disorders, emotional intelligence, mindfulness and well-being. So these are tests that are incorporated in Mindfitty that can help us self-assess. And what this does, this kills the stigma, because it's very rare for a man to want to come to a facility by himself without feeling any stigmatized or feeling any that kind of thing. Now, how do we? So once you feel you're feeling some type of way, you seek help. Now you can either go to the hospital, which is very rare in our setting, or in this case, like for example, my platform, you can go to Mindfitty. I'm not feeling well, let me go to Mindfitty. So you go in, you sign, you check, you self-assess yourself. Okay, so there are several things: anxiety, depression, whatever you're feeling. So you assess yourself, you assess your mood, you assess your well-being, and then you get a result. We use these standardized tests, of course, the PHQ, there's Hamilton tool for anxiety. There are so many tools. That there's the Cage questionnaire, and the RASPO for alcohol. So there are these specific tools that you try to, am I an alcoholic? Am I struggling with substance abuse? Am I struggling with addiction? So these tools that are here, you can have an preliminary self-check. Once you feel this way, what do? You seek help. So when you go to a doctor, when you're struggling with mental health, the best person to see is a psychiatrist. I know our healthcare system is funny, but we have psychiatrists and medical doctors who have gone through the undergraduate process, and now they are not specialists. They are specialists. So you can see a psychiatrist or a psychiatry resident like myself. So psychiatry resident is a medical doctor who is in school to be a psychiatrist. And so there are processes that we do. So we do what we call the normal history taking that is done to you, and the mental state examination that is done to you. So one thing that you have to understand is, don't allow people to diagnose you with mental well-being. Most of these people that you see on the streets, they calling themselves mental health experts, have no idea about what it means to diagnose someone with mental health. They have no idea what it means to handle a patient with a mental health condition. They have no idea what it means to follow up on. That's why you don't see them in Mathare. You don't see these activists in these serious hospitals. They are becoming like political, commercial activists, and that is my way with it. It's good to have healthcare providers at the heart of this. One of the things that I've seen, even the Ministry of Health is trying to do, the WHO is trying to do, is to train. It's good to have mental health advocates and counselors, but they have to be trained. You have to know how to make a diagnosis of depression. You have to know how to make a diagnosis of anxiety disorder, post-traumatic stress disorder, panic attacks, generalized anxiety disorder, you call it. And then once you have been able to diagnose these patients, you can now be able to give the right treatment plan. So in summary, there's a huge problem. So my whole essence of this video is just to tell you guys that it's okay to feel any of these symptoms. It's okay to feel not emotionally, cognitively, or behaviorally okay. But now for me, the most important thing is, after you've felt this way, what is the next thing that you do? You go to seek help, and that's where psychiatrists and psychologists are there. So normally, the standard procedure of being, you go to the patient, you go to the doctor will ask you the questions. So we ask you, what brings you here today? You'll say, I've been having low mood, I've not been sleeping, I've been feeling worthless, I've been feeling guilty, I've been seeing things, I've been hearing things. So that is basically what you tell the doctor, the normal list, the same way you say, I've been having this headache, stomachache, or whatever. So you say these things, and then the doctor will ask you, more. So you have been seeing things for how long? Okay, what happened? Has it happened before? What makes it worse? What relieves it? Are you on any medication? Do you take alcohol? Do you take bang? Do you take any form of drug? So these are the questions that somebody will ask you as one, trying just to establish what is the problem. When you say you have not been sleeping for how long, are you having nightmares? When you say your sexual life is not okay, are you having low libido? So those are the questions that we will want to probe further. And then there are several factors that are key at diagnosing a mental health issue, and they eventually result what we call a prognosis. So you'll be asked, tell me, what is your level of education? Are you working? What is the economic status? Are you married? Do you have a family? Are you divorced? How is there a history of mental health issues in your family? Did your parents have? Because most of these a good number of mental health issues are genetic. If your dad had depression, or somebody in the family had any mental health issues, it can affect you. It can predispose you to such. If any member of your family has any medical condition, they're taking any drugs, it could affect you. So these are the important things, and why you go to see, because going to see a doctor means we are able to have a good diagnosis of your condition. We are able to assess you holistically. Okay, so one thing that I'm advocating, the moment you feel like, hey, I'm not feeling well, I'm sad, don't sit on it. I've handled patients who have had issues at work, and I give this story about sexual harassment in workplaces. So I've seen several patients, especially females, they have been sexually harassed at work. So she was in this department A, she complained, she was taken to department B, she was transferred to another station, she still has this issue. So when I'm talking to you, you're telling me, I've been feeling sad, I wanted to kill myself, I feel worthless, I am tired, I have panic attacks whenever this person walks in the office. So beyond the symptoms, I have to dig deeper. Why? So I'm establishing that, hey, there's this boss who is harassing you sexually, the family backsetting is dysfunctional, the parents are divorced, you are staying alone, you're staying alone with your relatives, with your sister, you are not, and those kind of things. So you realize there are so many things that we have to ask, and that's why it's important for you to seek professional help, because now this one determines your prognosis. Prognosis means what is the cause of your disease. Is it going to get better? Is it worse? And so that's what we talk about when we talk about prognosis. Now, after these all things, now you have gone to the doctor has asked you so many things. So we'll ask you again, do you use any substances? We'll ask you again, how is your social life? Do you remember how you were born? Do you remember the age of your parents when they're giving back to you? Because some of these psychiatry issues happen with them. If the mothers, how was your pregnancy or children these days are having so many mental health issues. So you see a young child behaving funnily. So we ask, how was the birth process? How was the pregnancy? Issue of truancy. Did you refuse to go to school? Did you drop out? Did your parents take you to school? So we ask those social developmental history. How were you before you became sick? Before you started walking around? Before you started listening things to hearing things? That is now like schizophrenia. So what was we call it the premorbid state. How were you before all these conditions? When did you start using some of these things that affected you and your mental health well-being? So from all this story that we are having, we are collecting what we call a psychiatric history, basically. So we are probing you. We are just asking. The doctor is asking you what is happening to you, why are you feeling depressed, for how long, and those kind of things. Now after that, we do what we call an examination, a psychiatric mental health evaluation. When you go to the hospital, the doctor will look at your eyes, the doctor will do like this, they will look at your nails, they will take a stethoscope out, listen to your chest and your lungs, they will tell you to open your tummy, they palpate, these things we do. If it's a gynecological problem, they'll tell you go, they take a speculum, they check in there and those kind of things. So in psychiatry, we do what we call a mental status examination. So mental state examination, basically we're trying to, throughout when you're talking to you, a good doctor, when the good doctor is talking to you, they'll always be, while you are talking to them, they're also assessing what is happening, what is her behavior, how is her speech, and those kind of things. So we have to examine your mental state exam, and the mental state exam, it's a chronological thing that we do. So first thing we do, what is your appearance and behavior? How are you? Are you dressed well? Are you dressed like me in this nice Italian suit? How are you dressed, basically? What is your appearance? Are you well groomed? Is your hair neat? Do you look like your age? There's some people, they'll tell you they're 20 and they look like they're 40. So basically, do you have any scars? Do you have any abnormal tattoos? And all those kind of things. Behavior, are you calm? Are you irritated? Are you moving up and down? So we look at that, and then we look at mannerisms or body movements. Okay, are you tremoring? Are you fidgeting? Are you wandering around? So there are so many conditions. People with schizophrenia, they'll be having what you call catatonic movements. So they, sometimes they can have fixed gaze. Mtu anakuangalia tu hivi kwa ukuta. So we look at your appearance, behavior, mannerisms, body movements, and then the next thing we look at is your speech. How are you speaking? Are you speaking too fast? Like those people who have, if you have seen bipolar patients on the manic phase, they're speaking too fast. That is the speech rate. What is the volume? What is the pressure? Are they having pressured speech? Are they shouting? Are they low or slow? So there are those people who speak slowly or calmly. So we look at your speech, okay? And then the other thing we assess is your mood. So we ask you, how are you feeling today? Are you happy? Are you sad? What is your general mood today? So you're going to tell us about your mood and how you feel. I'm happy, I'm sad, I'm agitated, I'm hopeful. So that's what you feel inside. And then there's what we call affect. So affect, a doctor will ask you, okay, how are you feeling? So affect basically is not even how you're feeling. Affect is what I'm seeing, what you can express as your feelings. Basically, affect is the mood that is visible, because your mood I'm seeing from inside, I'm feeling happy inside. So you're telling me I'm feeling happy, I will assess your mood. Are you really happy? So there's some people who say daktari, mimi niko sawa, but ukiangalia uso yake amekunjika. So we say that affect is incongruent with the mood. Okay, so we assess your affect. You are telling us you're happy. Are you really happy? Does your mood appear like you're happy? Okay, you're telling us you're sad. Are you really sad? So we assess for affect, congruency, appropriateness. Is it appropriate? We can be talking about something that is sad and you are laughing. Okay, so we say that affect is not appropriate. So we have done your mood. And affect. So we go and assess now things that do with your memory. So we call it a mini mental state exam that assesses your cognitive function. So within the mental state exam, we do a mini mental state exam basically to assess your your cognitive function. So orientation, that's why we'll ask you, where are you, what time of the year, are you oriented in time, place, and person, who is this person next to you, and those kind of things. Orientation, attention, okay, and attention and concentration. So we assess for your attention. We can ask you to 100 minus 3, 100 minus 3, 97, 97 minus 3, 94, 94 minus 3. So we're just trying to assess what is your attention like and concentration. And then of course we assess your memory. Memory, there are 3 types of memory that we can assess for you. So we can assess your immediate, recent, or remote. So immediate, when you are talking to you, I'll give you a name. Okay, so I can say a specific word, and then I come and ask you, do you remember what? So basically I'm assessing your recent memory. Your immediate memory, when you are talking, I ask you something, can you remember? Your recent memory, when was your last meal, what did you eat last night? And then remote memory, who was the first president of Kenya, when were you born, which year did you join class 1? So we assess memory, important, very important in mental health assessment. After assessing the memory, we have assessed attention, memory, concentration. So we go and assess some other things that are very key. There's what we call thought. In fact, they should have come earlier. So we do assess your thought, and in thought, in fact, after speech, we assess thought. So thought, we are trying to see how is your brain thinking, how is your brain working. So in thought, that is very interesting. So there's what we call thought content. So thought content is where people have things like delusions. Okay, so delusions, these are persistent false beliefs for an individual that others don't see. Okay, so delusions, when you say this person is delusion is a problem of thought content. Okay, so when you say this person is delusional, you mean that his thought content is flawed. So he's believing in some things that is not true. Okay, and in delusions, we have delusions of persecution. You feel like people are coming after you. There's delusions of grandiosity. You feel like you're the man, you know. You are the, for example, people with schizophrenia, people with bipolar, in the manic phase, they feel they are God, they can conquer the world, they are married to Beyonce, you know, whoever. Those funny delusions of grandiosity that we speak about. There are so many forms of delusion. So persecutory delusion, erotomaniac delusion. Erotomaniac delusion now is the one where you feel like somebody is in love with you. You feel like this celebrity is in love with you. We call it erotomaniac delusions. In thought content also, we have bizarre beliefs, you know, we have obsessions, you know, and compulsions. People are obsessed with something. So somebody is obsessed with an individual, somebody is obsessed with something. So that is a thought content problem. You can even have though this is, you know, ideations issues. So suicidal ideations, though this one is very important, by the way. Have you thought about killing yourself? Have you thought of how you're going to kill yourself, when, and those kind of things? So those are thought content issue, mainly delusions and obsessions and compulsions and bizarre thoughts. Okay, then we have what we call thought process. So thought content is what you're thinking. Thought process is how you are thinking. So we have several different things that we assess when you're talking about thought. Sometimes I can talk to you and you're not able to coordinate things. We say you have loosening of association. You're talking to someone, they cannot process what you're saying, they are not able to communicate, you know. Sometimes you talk to them, you have heard of people talking about thought block. So thought block is a thought process issue or problem where somebody is not able to process the ideas and communicate. So you can be speaking to someone and just stare at you. We call that thought block. There are other more complicated things like what we call circumstantiality. So circumstantiality, a circumstantial patient is one who keeps bringing some things that are irrelevant. So you might be talking about maybe your family, and you keep bringing your friends, you keep bringing your school. So you're a circumstantial patient. You are bringing other irrelevant issues into the conversation. Now there is tangentiality. So tangentiality means we are talking about you, and you start talking about your wife, for example. So you're deviating from what you're talking, and it's very common. So you're speaking to someone about something, but they go away. They want to talk about Arsenal. You know, you're talking to them about their health, and they talk about arsenal, so that is tangentiality. We have perseverance. Perseverance is where now this patient or you, a client, keeps coming to the same thing. So we have finished talking about your family or your wife, and then I try, okay, let's talk about your children, but you still want to come back and talk about your wife. So that is perseverance. So those are different types of thought content problems that we assess in mental health or in psychiatry. And then from there we have now the what we call disorders of perception. So perception issues. Perception issues basically you are perceiving things that people don't see. Okay. Remember, delusions, you believe, you have these ideas and beliefs that are not the norm. But for perception, you have for example, one of the most common perception is hallucination. So hallucination is the presence of perception without a stimuli. So there's no, for example, we talk about auditory hallucinations. Auditory hallucinations, you are hearing things, people are talking to you, but there's no voice. Tactile, the same. You feel somebody is touching you, but no one is touching you. Visual, you're seeing things, but there's nothing to be seen that other people are not seeing. You're seeing ghosts. So that is what we call by hallucination. So you're perceiving things in the absence of a stimulus. We have illusions. Illusions is basically a misinterpretation of stimulus. So you can see a pen and you call it a spoon, or somebody can be calling John and you feel like they're calling Grace. So those are illusions. So those are thought issues that we assess in the mental state exam. So remember, we are assessing what is your mental status. Then now we were talking about orientation, attention, memory, and then there's what we call, we like to assess what we call abstract thinking. Abstract thinking is your ability to discern things. So we say, what's the difference between a mango and an orange, for example. We also, in abstract, also give you proverbs telling me the meaning of mtakasa cha mvunguni lazima iname, haraka haraka haina baraka. We tell you, can you tell us some of the meaning of these things? So basically you're assessing your abstract process. Then judgment is also part of the mental state exam. So we are trying to assess how are you able to make rational decisions. So we'll give you a case. Assume you are walking to point A and B, you pick somebody's phone, what will you do? Or assume there's a fire burning and there's a child inside, and then there's your laptop inside. So what will you do? We see whether you'll make the right judgment. So we do assess judgment. And then now finally we talk about insight as the final component of mental status exam. So in insight, what we do, we are just discussing about, do you understand that you have a problem? Do you accept that you have a problem? Do you know the consequences of the problem? Are you willing to take your medications? So insight is very important, and it's one of those prognostic factors, because a patient that is insightful will take the medications. Essentially, that a patient that is insightful will be compliant and adherent to whatever plan or treatment plan that we give them. So most of us, not most of us, but a good number of people that I've encountered do not believe they are sick. So these people have no insight, okay? So you will tell them, but then you have this condition, you should take this. So they don't take medications. They don't come to the clinics. They don't believe they are sick. They say their relatives are picking on them. You know, my mom has brought me here. I've seen a case in Mathare where the son was actually hating on my mom. This was my mother, but until today, she's not, because she says nimekuwa mwenda wazimu. Okay? So the most important thing is to have insight. And once you have insight, it becomes easier to treat the conditions that we have. Okay? So basically, that is what we do. Now, after you have taken your history and you have done this mental status exam, that is when we come with a diagnosis. That's where we say this person has bipolar, this person has schizophrenia, this person has depression, this person has eating disorder. Okay? So it's very important that we don't take the shortcut in trying to now, because what happens, we have a lot of misdiagnosis of mental health issues. We have a lot of misinterpretation of mental health conditions. People are on medications. People don't know what therapy is. Some people go to therapy, it doesn't work simply because it's not the right diagnosis. And you cannot treat what you have not diagnosed properly. So we are saying is what we are saying is that it's important for us to do the right thing when we feel like we have any altercation in the mental health issues. I've built a platform, or I'm building a platform that will help us from that perspective. Have that self-check, have that self-diagnosis, understand what mental health issues or what mental health condition is. I think in the next step now, I'll also be asking you guys to tell me what you want me to talk about. I feel like next time we're going to talk about maybe mental, whichever condition you want to talk about, sexual disorders, eating disorders, neurocognitive disorders, dissociative disorders. There are so many. Okay. And when you have these conversations, I build it around my platform so that when you talk about this, you go to Mindfitty and you check it out, open an account, have a dashboard, seek mental wellness or mental treatment with it, and then we have the conversation forward. Thank you very much. I think I did this video because I felt like I'm looking so good in this suit, very fitting. I hope I'll do another video maybe later in the week, and then we're going to have more of it. So thank you. Subscribe to my YouTube channel, TikTok channel, Instagram, Facebook, Twitter. And I go by my names, Mbiti Mondi. And we're going to discuss more, not just about mental health and many things that I like talking about, politics. But today I just felt like I wanted to give you guys that simple thing about mental health. Thank you and have a good evening.